Today we've been called out to a 50-year-old female who is tripped and hit her head on the coffee table. Her vital signs are all normal, except she has a elevated heart rate of 90, but she has a GCS of 15. Primary survey has shown that her airways are patent, her breathing is normal, and she is of good colour with strong radial pulses. A secondary survey has shown she has a bump on the back of her head and pain in her left ankle. Hi Kathy, my name's Hannah and I'm just going to do a couple of assessments on you today. First off, we're going to do a neurological assessment. Is that okay with you?
That's fine.
Perfect. Now I'm just going to ask you a couple of questions. Do you remember everything that happened before and after your fall?
Yes.
Yep. Can you tell me what day it is?
It's Wednesday.
Perfect. And what month are we in?
September.
Cool. Now, did you lose consciousness when you hit your head today?
I think I did.
You think you did? I'm just going to run through an acronym that we call AEIOU TIPS, and that's just going to help me understand why you might have lost consciousness today. Have you had any alcohol today?
No.
Do you or your family have any history of epilepsy?
No.
Cool. Do you use any insulin or need insulin?
No.
Perfect. Have you had too much or not enough of any medication or drugs today?
No.
Perfect. And any trauma?
Yes, fine.
When you hit your head?
Yeah.
Perfect. Any infection?
No.
Any psychosis?
No.
And any family history of any strokes?
No.
Perfect. So, like we thought, the main cause of your loss of consciousness is when you hit your head on the table today. But just to double check, I'm going to do a fast test which will help further rule out that you've had a stroke event today. So, as I can see from your face, you have no obvious weakness. Can you do a big grin for me? Perfect. Can you put your hands up facing the roof and close your eyes? So while she's doing this, we're looking for any lopsidedness or pronation. And can you squeeze your hands? Perfect. And pull me in and push me out. Perfect. And say your full name for me.
Catherine Barbara Matheson.
Perfect. So we can tell from that her hands are, there's no weakness in her hands and her speech is fine. Now we're going to go through the cranial nerves just to check that nothing else neurologically is going on. Now for cranial nerve 1, we don't do this in the pre-hospital setting, but for cranial nerve 2, what I want you to do is bring your finger to your nose and out to my finger, back to your nose, to my finger, to your nose, and to my finger. Perfect. Now for 3 and 4, I'm just going to shine a light in both your eyes. Perfect, so your pupils are equal and both reactive. Now the next step, I'm just going to press this on points of your face, and if you feel that, I want you to say yes. Is that alright?
Yes. Yep. Yes. 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 Yes.
Perfect. Now can you do a big teethy grin and raise your eyebrows and puff out your cheeks? Perfect, so that's testing cranial nerve 7. And now what I want you to do, for cranial nerve 8, this is your hearing. So is your hearing now when you're talking to me the same as before your fall?
Yes.
Perfect. And now can you cough for me? And swallow? Perfect, that's for cranial nerve 9 and 10. And for number 11, can you shrug your shoulders and turn your head either side? Perfect, so we're just checking she can do all these movements. And can you poke your tongue out for me? Open your mouth. Nice, just checking that there's no swelling or any differentiation of the tongue. So, cranial nerves all look good and your neurological assessments have been good. And you just feel, how do you feel now with your headache? Is it just still a headache in the back? Perfect, so we'll give you some pain relief after we've done your ankle assessment. Okay. Now you mentioned earlier that you'd taken a couple of steps from the coffee table over to the couch, weight bearing on your left ankle.
Yes.
what pain score was that? If 10 was being the worst pain and 0 being no pain at all?
About a 7.
About a 7. So since you have been weight bearing, we're going to do the Ottawa ankle rules, which gives us a determination if you need to be imaged or not. So you have been weight bearing, which is great. Do you have any bony tenderness on this side?
No,
And on this side under here?
just a little bit.
Just a little bit. And can you tell me when you start to feel pain?
About here.
About there. There's no obvious deformity, slight swelling on this side, but you're negative for the Ottawa ankle rules, so you won't need immediate imaging. I'm just going to do some baselines for your feet now and ankles. So they're both of the same colour, they're not pale or blue or anything like that. They're both warm. Both got a cap refill time of 2 seconds. Can you feel me doing that?
Yeah.
Does that feel the same as that?
Yeah.
And that feel the same as that?
Yes.
And can you just put some pressure on my hands and this foot? Perfect, and that's not too painful. I'm just going to find a pedal pulse. And then once I've found that, I'm going to mark that with a pen. So your limb baselines are all good. There's no loss of sensation or delayed refill time in your foot. So what I would recommend is that you rest up, ice your ankle, and elevate it as well.